Let's jump right into this explainer. We're looking at a truly fascinating piece of tech that's completely changing how we rehabilitate a fundamental human function, the ability to swallow. We take it for granted every single day, right? But what happens when that automatic reflex just vanishes? Today, we are diving deep into transcutaneous neuromuscular electrical stimulation, or NEMS for short, and how it's basically being used to rewire the swallow.
Here's our roadmap for today's explainer. We're going to cover the challenge of dysphasia, how NMES actually upgrades therapy, the difference between sensory and motor stimulation, the incredible role of neuroplasticity, the massive benefits for stroke patients, and finally, safety and treatment optimization. Let's get to it.
Section 1. The Challenge of Dysphasia. To really appreciate this tech, we've got to understand the sheer severity of the problem first. We're talking about oropharyngeal dysphasia. So when a stroke, a traumatic brain injury, or a neurodegenerative condition strikes, it can seriously damage the complex network of nerves and muscles in the throat. Imagine literally not being able to safely swallow a single sip of water. The immediate risks are huge: malnutrition, dehydration, and silent aspiration. That's where food or liquid slips into the airway unnoticed, which can cause life-threatening pneumonia. For a lot of patients, this grim reality means a total reliance on feeding tubes just to survive.
So this creates a really tough mechanical dilemma for the speech-language pathologist trying to treat this. Think about it. How do you rehabilitate a muscle you can't even see? Traditional therapy leans heavily on swallowing exercises, compensatory tricks, and changing posture. The therapist basically asks the patient to perform these effortful, hard swallows to rebuild strength. But if the neurological connection is damaged or severed, asking a patient to just swallow harder is incredibly frustrating for them. The muscle just won't fire.
Section 2. How NMS upgrades therapy. And that brings us to our technological amplifier. Think about traditional therapy for a second. It relies on immense, conscious patient effort to relearn techniques and physically force weakened muscles to work. But then you bring in NMS therapy. Now, to be clear, this doesn't replace those traditional exercises. It actually supercharges them. NMS uses targeted electrical pulses that pass painlessly right through the skin of the neck. These pulses actively recruit and contract those hidden swallowing muscles. So when the patient tries to swallow, the NMS device kicks in as a powerful amplifier, boosting that muscle recruitment and stopping muscle atrophy right in its tracks while they exercise. Setting this up in a clinic is a highly structured process. Step 1 is the assessment. Therapists often use imaging like video fluoroscopy to diagnose the exact mechanical failure and figure out precisely where to place the electrodes on the front of the neck, usually over the suprahyoid or infrahyoid muscles. Step 2, they calibrate the electrical intensity to what the patient can comfortably tolerate. And Step 3 is where the magic really happens. The patient actively exercises those swallowing muscles while the therapist paces the electrical stimulation to match. These sessions can go for up to an hour, perfectly combining human effort with that crucial electrical assist.
Section 3. Sensory versus motor stimulation.
Now, this begs a pretty big clinical question. How much electricity are we actually using here, and what is it doing under the hood? Well, it breaks down into two distinct approaches. First, you have the sensory approach. This uses a lower intensity current that doesn't actually contract the muscle. Instead, think of it as a localized wake-up call to the central nervous system. It sends signals right up to the brain's central pattern generators, basically reminding the brain how to initiate a swallow. On the flip side, you have the motor approach. This cranks up the intensity past the sensory threshold to do the heavy lifting. It literally forces the muscle to physically contract, which builds strength and reverses atrophy. Both approaches are super valuable, but the research definitely leans into that motor approach, combined with active exercise, for getting the absolute most out of muscle recovery.
Section 4. Neuroplasticity and brain recovery.
But here's the coolest part. Beyond just flexing the muscles in the neck, this therapy is doing something absolutely incredible inside the brain itself. Researchers monitored patients' brains during recovery and found that, quote, the cortical map was expanded after electrical stimulation, indicating a therapy-induced recruitment of new cortical areas. Just think about what that actually means. The electrical impulses from the neck are literally traveling up the nervous system and helping the brain reorganize and rewire itself. It's inducing neuroplasticity. The brain is actively finding brand new, healthy pathways to take back control of the swallow, totally bypassing the areas damaged by a stroke or an injury. It is just amazing.
Section 5. Benefits for stroke patients.
The theory is brilliant, sure, but let's look at the tangible human outcomes. What does this mean for real people, especially stroke survivors who make up a massive portion of these severe dysphagia cases? Well, Data from a randomized controlled trial of 60 post-stroke patients shows the real-world impact perfectly. Just look at the complete cure rates after only 10 days of treatment. In the control group getting just traditional therapy, 30% of patients were considered cured. But the group getting NMS alongside their therapy, that number jumped to 57%. NMS literally almost doubled the complete cure rate.
And it gets better. Another major study looked specifically at stroke patients who were entirely dependent on feeding tubes. They found that a staggering 51.6% of those treated with NMES achieved minimal or no swallowing restrictions whatsoever. That means they could go back to eating a normal, varied diet. Compare that to just 26.6% of the patients who only had traditional therapy. And maybe even more importantly, the patients receiving NMES had significantly higher rates of being discharged back to their homes and communities rather than being sent right back to acute care. That is a real game changer.
Section 6. Safety and Treatment Optimization.
Given these incredible results, clinicians obviously want to know exactly how to optimize the current for maximum effect while keeping the patient totally safe. After years of trials, a scientific consensus has emerged on the perfect parameters. The sweet spot for frequency is right between 60 and 80 Hz. And why is that? Because an 80 Hz frequency perfectly targets our fast-twitch muscle fibers. You see, swallowing is a super rapid reflex-driven action to protect the airway, so it relies heavily on those fast-twitch fibers. High-frequency NMES recruits those exact ones. They also figured out that a pulse width of 700 microseconds is ideal, applied to the front of the neck for 20 to 30-minute sessions. But honestly, the most crucial takeaway here is synergy. NMES is at its absolute best when combined with traditional active swallowing exercises. It's a tool to enhance human effort, definitely not replace it.
Now, what about safety? Fortunately, the profile is exceptionally good. I know, dealing with electricity on the neck sounds pretty intimidating, but the reality is actually quite mild. The stimulation can produce a little tingling or warmth, and at the motor levels, you get a noticeable grabbing sensation as the muscles contract. Across all the literature, the most common side effect is just some minor skin redness or irritation right under the electrode pads. Therapists can easily fix that just by moving them around a bit. There were absolutely no serious systemic complications reported across the major meta-analyses.
Ultimately, bringing this kind of tech into the rehab clinic is all about time and quality of life. One study summed it up beautifully, concluding that NMES shortens recovery time and significantly improves swallowing function. It's really all about accelerating that crucial neuroplasticity, getting patients off those uncomfortable and limiting feeding tubes, and giving them their dignity and independence back so much faster than traditional methods ever could on their own.
So, I want to leave you with this final thought as we wrap up this explainer. We've just seen how targeted electricity can recruit muscles, literally expand cortical maps in the brain, and restore something as fundamental as swallowing. It really makes you wonder, as our understanding of NMS and brain plasticity continues to deepen, what other lost human functions might we be able to help patients reclaim in the future? Thanks so much for exploring this absolutely fascinating topic with me today.